My people, now welcome. Now, good afternoon. Welcome to another episode of Ability Inside Disability. Happy new month. So today is the first episode for this our month of February, and today we get very interesting topic. I go introduce our studio members. Some of them still day traffic. It's a traffic day today. So traffic don't hold some of them down. But for now, we go start our podcast with our very own regular, Mr. Ini. Good afternoon, sir.
Correct people, good afternoon. Thank you. I hope so on a don't sit down where I bet call person, tell person say that podcast really the learn where we don't start to.
Yes, so
and
we
I
don't
welcome.
start. Well done, Mr. Ini.
Thank you.
Today our mommy, she know they here with us. She remind us say today was Epilepsy Day. So we say make we also talk.
Or you go born picking with na lie, na big lie. And I no go on talk everything about them. We don't do episode before on top this
we don't do
epilepsy matter.
episode,
So
yes.
I believe say our back end people go help us follow bring them back.
Yes,
Or
yes.
maybe send link so that on a go fit go there, go benefit from that video.
Very
Because
important.
Dr. Bako finish work
Very
with
important.
explanation of that
You
thing.
see, it's very
Yeah.
important. You know, say
Yeah.
for this our community and for many diseases, especially for this part of the world, ignorance too plenty.
He plenty.
You see, people know the research. Now, waiting my neighbor talk, waiting neighbor tell them. Now, waiting my pastor talk, waiting madam with the mosque talk. There is no proper investigation. Everybody just they add their own, they add join, and children they suffer. Adults they suffer.
That's what it be.
So we need proper education and proper information at the end of the day. So make I know to talk. Our topic for today, say since the beginning of the year, the way our topic they go, they follow each other.
Yes.
We start with a regular greeting, then we enter goal setting, then we enter strategy where we say parents if we give parents and guardians support.
Yeah.
Today topic now, this support now we say okay, give children support, give them support. The question we say where they want to find this support.
Thank you.
Say it's different. Maybe we say okay, cook rice. Where market day you won't buy tomatoes, you go buy rice, you go cook stew. You need to know all this location, all these people, so that you go not say okay, I go this person house, so go buy rice. I go here, go buy tomatoes. It will make my life easy. So this topic now, basically, where parents will get access to both resources, even the diagnosis self. Get access to the resources, the diagnosis for our children. We get cerebral palsy, we get Down syndrome and other developmental disabilities, and also of course including help for this epilepsy where we talk today. All of them very important help. Now as per therapists, Mr. Ini, and person where they work with these children on a regular basis, one of my main question now we say wetin be the main therapy wey be say children wey get cerebral palsy, wey get Down syndrome or other developmental disability. So wetin be the therapy wey dem fit get and how we fit help them, help the pikin grow. So and also if possible how these parents fit even know say their children need this therapy in the first place.
Okay. The way you take put the question, I go start from the last one.
No wahala.
Because it caught us say how the parents won't even take say their own
say that one
picking
sef
need this
dey,
therapy.
yes.
Now, what I want talk now, no be to put fear for anybody body, but now make you feel they informed. And say most times if you take decision or if you do something from position say you know what they do, the results most times it make sense than say you just enter panic mood. You go begin ensure if you go the add fuel inside the fire.
I'm telling you.
Now, if you get picking, where as they grow, you doubt. Make her bring them down as much as possible. You dey doubt any part of in development. You the reason say, Kai, by this time this picking supposed to do like this. By now this picking supposed to sit down.
That's so.
Other children in mates we born the same time we born. Maybe I don't even go online, go read, say by so months, the pikin supposed to sit down now. By 6-7 months, pikin supposed to sit down. But your pikin, if you keep and you don't go that, if you force her, you go begin shout where. Now something to make you not panic, but now something to begin shook eye. Then around that period self, you dey call your pikin name, you dey smile with her, you dey play, you dey laugh, you dey the pikin no dey even behave like say anything dey happen. In face, emotions, expression, nothing. You go just keep straight face, right? Or something fall like this, bam, for back. The pikin no even shake like say he hear something loud sound way back, you no respond. Yeah, okay, make we say the pikin don't reach 1 year. 1 year, 6 months, 18 months. You they call the pikin name, the pikin no they even send you. Maybe they do something for you, they call him name, he never turn. For conditions like cerebral palsy now, we be say they affect muscle coordination, muscle tone, movement. That one you go there very obvious. Say maybe your pikin, maybe the hand bend one kind. From baby, you don't they try straighten the hand, the thing go back. If you too press on, the pikin go begin shout. Then stiffness. At this point, you go suppose no say kai something dey different.
Exactly.
No be to panic, but immediately you don't observe say anything dey different with your pikin development. First thing you suppose do, na to go hospital.
Again, early intervention.
First thing, before you go consult people wey no be professionals for field.
No enter church. Say when you go hospital, you enter church, you enter mosque, enter everywhere.
Go dey, no go meet people wey go dey tell you most times wetin not good.
Not true.
Go hospital. Now hospital you foresee professional. In short, if you go hospital, ideally, maybe you go meet general practitioners, people when they call maybe family doctors and the rest, the family physicians.
Yes.
You go meet them. Then get basic knowledge. But if you pass them, then go either refer you give pediatrician. Pediatrician now be doctor who they take care of children. They go refer you give pediatrician ASAP. Pediatrician now, especially developmental pediatricians, they go know. Okay, they go ask you like, Mama, Abi, Papa, how old be your pikin? How many months? When you born am, you get anything will happen during the period. That's when you dey pregnant, you get anything will happen. Not vex when they ask you those kind of questions. I beg, I won't follow add one thing, no lie. Because all these questions now, they want to understand wetin fit be the reason why anything. Your pikin development they different.
Yes.
At this point, they use different.
Yes.
Right?
Yes.
Because if it no be waiting with the fear.
That's true.
But now the professional now go fit tell you. After you don't meet these professionals, may them tell you one or two. Even them man we did that place. Now their place too to say, okay, see waiting they sup with your pikin, but see waiting and waiting go fit help. Now they go fit recommend the different forms of therapy and intervention where you fit assess, where you fit find, we go begin help your pikin from that early stage. Yeah. And one example is make we say children where you get cerebral palsy. We don't follow do episode on cerebral palsy for this house. Now, cerebral palsy, they affect movement. It affects muscle coordination. Some the muscle they very weak, and some the thing they over stiff. The brain they over fire. Say the pikin be the person fit they eject self. You go just the body they eject, and no be saying na in they control am. Involuntary. Now so the body go they. Now. At that early stage, with physical therapy, you get what they call physical therapy or physiotherapy self. Now form of therapy, people they will be saying that their area of specialty be that. Then go feel help the pikin and be the person. Conduct all those massage and all those things where they shall do inside physiotherapy. We go help with the flexibility of the joints and the muscles, and for the ones where the muscle tone they very weak, and they go feel help and build strength, build coordination. Where imagine say you start early and you don't run this thing for 5, 6, 7 years. Plenty things go don't change. Plenty things go don't change. Another one occupational therapy. Make us start from the ones where go fit significantly where improve quality of life for these individuals where they are community. People will get learning, intellectual and developmental condition. Another one occupational therapy. Occupation. Make I explain now, because the way the thing they say, it be like person where they find work. Occupational therapy na the kind of therapy where they teach person how to do the things what they do every day.
normal things
where would they do it? For instance, example now, I say occupational therapy go fit teach pikin how to hold spoon, pack the food, put am inside mouth. Maybe say you no go dey wait make person dey feed am. He go fit learn how to feed himself. Occupational therapy go teach pikin or he go teach individual how to wear him cloth by himself. Because if you leave am like that, if you dey dress the person till he enter adulthood,
and you know they help him like that.
You know they help him. You know they help him. So with that occupational therapy, he go feel learn how to wear clothes, learn how to feed himself, learn how to brush teeth, learn how to comb hair. Then if he go graduate reach stage where we say the pikin go learn how to do small things for house. You go learn how to sweep ground. You go learn how to mop. You go learn how to wash plate. Skills of daily living. Thank you. Survival skills. Now, waiting occupational therapy they teach me that. And you know, say for this our children within inside our community, sometimes things where other children just they learn, say they just they work out or they see other people they do them. For children where they our community, sometimes you go need they teach them.
Exactly.
And if you don't teach them, while good day.
You say they don't get the I don't even know the piece I want to come now. The trajectory of normal our so-called normal children. So all of these things will be say we need to say now normal behavior. We need to teach them like you mentioned now. This therapists go come in. We need to teach them. Exactly.
And that one now speech therapy. Make her do and sharp. Make her no come carry everybody time. Speech therapy now. People will get some people will get Down syndrome.
Yes.
People will get cerebral palsy. Cerebral now muscle, and even to talk now muscle will need how they use. People will get autism. Plenty times they follow get speech and language disorders.
That's true.
Now speech therapy go fit help them build speech, learn how to talk, and even inside the speech therapy, because sadly sometimes not be every pikin now go talk using words, but communication is plenty. Like channels to communicate plenty.
Everyone they find me picking talk.
Plenty ways they to communicate. Speech therapy, if you even teach the picking how to use pictures, they talk.
Exactly.
If gestures and all those things. So I don't mention physical physiotherapy. I don't mention occupational. I don't mention speech therapy. Now behavior therapy. Our children plenty times they feel follow get what they call challenging behaviors. Maybe pikin don't they try communicate, but you know they grab, you never they on the same level with and the same frequency. If you build frustration,
go verse.
Or sometimes based on waiting they go on the inside, maybe they get some kind of rest, maybe they get indigestion, maybe even head they pain and you don't know how to talk to you. Most times now behavior you go take show.
That's true.
So behavior therapists now go now teach the pikin appropriate behaviors. Then also help the pikin, be the individual now reduce most of these challenging behaviors, make it for feel go far. Educational therapy is plenty, but make us start with these few ones where I don't mention.
Yes.
Now some of the strategies we use support our children we get these conditions and the family.
Thank you very much, Mr. Ini. And people, as Mr. Ini talk again, in fact, the very first step for all of this thing, I say, make una observe una children. You born pikin, you need to make sure say you dey look after your pikin, you dey watch your pikin, so that you no go miss that prime time for intervention. Because once you miss them, not be say you no fit intervene, no, but it is hard. You know, they easy as when the pikin is still small. So it's important maybe you watch your children. Once you don't notice something, don't carry your pikin go one your church sister, your church brother, be pastor or be madam house. Go hospital. People will go school, they don't go school for nothing. Go hospital, find out, they go refer you. So to follow this question now, not say we don't mention behavioral therapists, we don't mention occupational therapists, speech therapists, and physio. Now, all these therapists now, parents feel find them. Not say, and I wanted to know say you need them. They go feel find these people. How do you go feel find them?
Now make our first carry this question now, come back house.
Exactly.
At least for the benefit of people who just they join us.
So
now Nigeria will from the do this podcast.
Very important. very very important information.
positives there, but make I just paint them, make I paint small picture.
The reality.
Make I feel sure now. Now, these therapists, trained professionals, follow this country. But sometimes to fit gather this information, now it hard. And the reason I say the place where would they keep information, to coordinate like that, is they call database. Say, say, make I use Ideal. Ideal no go kill me for this one. Make I use Ideal. Ideally, you enter particular town, you define hotel where you go feel where maybe you no get a person for the time, you define hotel where if you go keep your head. You suppose be say maybe you enter somewhere, if you just see one registry, we go show you the list of hotels within the area where you want to stay. Then you go begin look review, look everything, then pick the one where you want to go.
Not true.
You enter town, you define where you want to chop your local dish. Database registry suppose there you check say these people, the way this their food be like say you go software.
Exactly.
You pick up, begin go there, go chop. Now, registry not today like that when it comes to finding therapists locally. I know say a few international organizations now, we don't license some therapists within Nigeria. You find few people for some of those places. But the easiest way to find support inside this community are to go hospital first. If you go hospital, especially if you go, then they refer you, give pediatrician or even a clinical psychologist or all those professionals where they work with our children, people for our community. At all, then go get one place where they go tell you, go here.
And from there you go find another one.
Thank you. And then if you go there, maybe say you don't pass your budget or you not like the environment, you not do you for body, you feel ask and say, where again I feel go. You understand? Now the easiest way, since you know if you just carry your phone, say I dey find speech therapists for just Nigeria, and it go show you names.
I don't know deal. If they never there online by themselves, you don't go find them. The problem with that.
Yeah. So now the reality with that.
So as some people don't hear again, hospital. Again, enter hospital and make sure say you speak to people who be say they're professionals. They go refer you, then from there you go make your progress. Say at the end of the day, we need to work with how Nigeria be. In the organization, not too pristine like that. It get as it be. So we go use sense, navigate so that our children go get the help where them need. So make we go on. Say now we don't get occupational, we don't get therapists, we don't get people where we say them go help us. We don't know where we should find them, hospitals and the likes. Now, many of our parents, money no day like that. Say many of our parents and caregivers, money no too plenty like that. And so how these parents still feel access help when money no be the plenty like that. You talk just now say some people feel they expensive, you feel they above budget. How they go still feel get access to help for their children when you don't do all of their findings, you don't go the normal route. They can't realize say this route where they go, the money no deal. So how they will navigate this situation?
You see, now when I brood on top this matter now, it is very easy to begin say, okay, see what if you do, go talk to this person, apply to this place for grants, find these people for sponsorship, do this one. But in the real sense, when you come down to the real issue, I don't identify one thing where they very empowering for parents, where we strengthen them, help them, make them feel support their children in the long run, especially if they not really get the means.
Yes.
And what I want to suggest on top this yarn today, and I say, you the parent, get trained. Find place, do training. You self do training. Now you, in short, imagine say okay, just picture am this way. Therapist, no matter as in love your pikin, na outsider.
Na true, no be the
and
same.
na business.
No be the same.
So imagine say you wey born the pikin, you can't get the training. Who again for this world fit help your pikin pass you?
Na true.
So today I want to say for parents wey dey struggle with means or the rest, wey they no fit afford cost of therapy, because I no go lie for you, sometimes some of these therapies dey cost dear well.
Yes, very expensive.
You ma waka carry yourself, plenty trainings dey wey dey support, okay, occupational therapy trainings dey, behavior therapy trainings dey, even speech therapy trainings dey. Even if na entry level you wan start with, then begin dey grow small small, because most of these therapies you go get supervisor, so that if the thing pass you, you fit reach your supervisor, and your supervisor will fit tell you say, okay, use this other strategy, use it. Then you come back house, come implement am with your pikin. That you don carry the burden of say you wan dey go apply give person, apply give here, find government grant, find government loan. But if you no fit to this part, abi you no fit use this strategy when I don share now, e get some non-profit organizations wey once then they sponsor some children. Maybe they don't meet the family, say kai, these ones they really need this help.
True.
Do the screening, then they will come say, okay, we go sponsor your pikin for so this therapy for so and so duration, maybe for 1 year, for 2 years. We go sponsor and you go school.
Exactly.
And sometimes the sponsorship, some places go say we go sponsor school fee, but if the pikin need behavior therapy, the sponsorship will not cover. Then you go begin find other ones. And I know say once self, government through different initiatives,
yes,
once but wetin be the chances? We
the chances no high like that. No high like that.
So now my personal recommendation, the other people when they studio fit get wetin they fit talk put, but for me I go say, if you fit, may you go do training.
Very important. Make you train yourself. And I think say, from also personal experience, if you train, if it also help you get more, what they call empathy. Say you go understand the pikin more. Your patience too go increase. Say if you don't know something, you go assume say your pikin are normal pikin. And or suppose normal. Say as they get training now, also form of support for parents, because they make them feel say okay, and they know they're completely hopeless. They feel do one or two things to make situation at least a little bit better. So it's very important, like you mentioned, when parents get their own training. As we talk just now, two of our very special guests enter our studio. So make I introduce them very quickly. For my left, Mr. Ezra. Good afternoon, sir. You're very welcome, sir. Mr. Ezra is a parent for this our community, and he will give us insights on the realities and how he definitely navigates situation with your own pikin from a parent's perspective. Say official, clinical, of those things but the day-to-day navigation, that one self day. Then we still get our clinical psychologist, for studio, Mr. Phillips Dimka. You're very welcome, sir. Thank you, sir. Thank you. So, Mr. Ezra, I go start the question with you. So I want to know. So we don't discuss therapy before you enter. Say parents need to get therapy for their children where they on this, we get developmental, whether it's cerebral palsy, Down syndrome, or developmental conditions, disabilities. So where you they go for your own therapy for these children and for your own medical care for them? Where you they go? You say you don't trust them, so that parents where they find place for their children, if you use that one as a reference.
Good afternoon.
Welcome, sir.
Thank you for this wonderful opportunity. I greet you all. Parents actually.
That get with you.
Get with. Well, my picking for medically they receive treatment for Bingham University.
Okay. Okay.
For the therapists, for open doors, open doors, especially school.
Okay.
For now, oh, we thank God. The therapists, they are trying.
Yes.
You know, one thing with these children, their own response are very slow.
Not true.
Be patient.
Patience, very important. Patience.
Because not be picking where you expect you will just learn all of a sudden, like normal picking.
Not true.
The normal, like the normal children, even for first term, where you carry them go, before that term finish, you must see something.
Exactly.
Give them
Progress.
something.
Progress don't come.
But for this one, like for the whole term, like my own, for the first term, I don't know, it just there was no any changes. So,
One time na 3 months, so I believe so.
yeah. So if you not get patient, man, you will feel say, this, like say this school where my do, you gonna just waste of time, waste of money.
Not true.
So you need patience to allow him, so he will pick up.
Not true. Patience. So my people, when I don't hear, our parents mention open doors, and he mentioned which Bingham University Hospital. So this one a resource also, and as we go, we go the add them more so that parents with the outside do not feel reach out to these places for help. Because and also in all of this, make sure say, I'll say this whole process now patience. Regular picking need patience, not to talk of special picking. So there needs to be patience and accommodation. You self way day house, Abisa, as parents also you supposed to do your own role at home also. Maybe so. So that you will make sure say, the work what they do for school, you continue and for inside house. So I want ask question to our clinical psychologist. Sir, so how learning intellectual and developmental disabilities fit affect the pikin mind and emotions? And which role psychologists fit play for all of this one?
All right, thank you for the invitation to speak about this issue, because na real issue where they affect us for society, and especially the children we get some of these disabilities. So basically these disabilities, they impact on the Peking mind and their their emotions. And one thing we I dey observe for some teachers and some parents be say we they forget say these children nobody them make this the decision to be like them they or to get that particular challenge or difficulty. Okay. So sometimes you go see even how we they treat some of these children, because like my guy here talk, we need get patience when we they interact with some of these children. But one way it they affect the minds or the emotions of the children we get some of this disability, we say they go begin struggle with self-esteem issues. They go they question themselves, why are they like this, waiting happen to why no they like other children. See other children, they move, they jump, they walk, they learn, why me they hard before I do all of these things. So they begin to think small of themselves. They think say, something they wrong with me, maybe all sorts of feelings. So before they get what they call self-esteem issues. Though they get low self-esteem, they'll get poor sense of self-worth. How did they measure themselves?
Yes.
In relation to other children.
Yes.
Go they poor. Go they affect how did they think about themselves. That's now one of the common issue. And for some of those children, one way they affect them again now anxiety, or one common way you go see say they always they anxious. Anxiety now just say person they worry too much. They restless. They worry too much. They overthink. So they affect how they think, how they feel, how they manage himself. So you go see say some of those children they very anxious, because why they don't feel do certain things. They go they frustrated. They go they angry. They don't go feel control their their emotions. Sometimes
Tantrum
they
go
go
follow.
Yeah, tantrums go follow. You understand? Waiting we they call strong head go follow.
Exactly.
Waiting we they call disobedience go. We they label them, but actually na struggle where the pikin they struggle, they manifest in those tantrums or misbehavior or whatever we they call them. The name we will give them. Well, ideally they tell you say this pikin they struggle with his current experience.
Yes.
So either the pikin go they anxious, the emotions go they rage, or the pikin go even they feel they withdrawn. He go lock up. He no go they talk. He no go they relate to friends. He no go feel play. He no go want go school. He no go want come out because the way people they look am for road self go they make am feel like say something they wrong with me. I know they normal. So they go begin they withdraw. You see say they know they talk too much. They lock up. They no go show emotions. They struggle quietly. Before you know depression don't set in, they go always they sad.
Not true.
So these now some of the common challenges where children will get developmental disability they struggle with.
Yes.
Some common ones.
Very common. Thank you very much, sir. Thank you. So as you don't mention all of these issues and we feel trace them to besides that tantrum and frustration. Like Mr. Ini mentioned one time, some of these our children then they non-verbal. They know they talk. So you add anxiety plus the fact that you never feel express saying they anxious together. Exactly. You feel expect the outcome. Mr. Ini, as our clinical psychologist they talk just now, we get one question from our viewers with them they online. The person say, make I get the question. He say where how parents fit get that training. You know, say we mentioned just now, say parents, if money no dey to employ, because somebody don't talk say some people no fit afford 2 square meals. So no talk of me they give pikin therapy, and you talk say parents fit try to get trained. So where these parents fit even navigate that getting training? How they fit navigate them?
This person don't follow this our yarn since morning, and a better question. And what I go fit talk put sharp for this question and say make this person, if you never follow Modupa Fizogun Foundation on top Facebook, Instagram, even YouTube, I bet good one sharp because towards the end of this first quarter of this year now we will put out information. Say we won't make life easy as much as possible for as many families as possible. Where these conditions don't touch. So we on top this foundation now don't put together a team of professionals. We go provide trainings. And of course, because say we dey run a non-profit foundation, you go follow the affordable and accessible. See English where I speak for Pidgin program.
No problem, they go understand.
As in this one, plenty people will fit do am.
Yes.
It go dey easy, even for person like wetin you talk with, they struggle to even see two square, two na square. I don't know the reason now.
Now the comment, are you like that?
But we know wetin the shall talk. So the foundation don't take them upon itself. See, they go provide this training. So I bet more na follow us. A small time when I go get information on how to access these trainings. I will tell if you talk put with that.
Okay, now people una well done, and una hear Mr. Ini talk say by the end of this first quarter, our foundation they get training for as many people as possible. You know, say the person will start this foundation should be parents, and now her fuel be that for this foundation. You know, say when you don't live inside the problem for so long and you don't do your own research, you don't go everywhere you feel go to find solution, they push you to help other people will be like you for that same situation. Maybe say them today they that state of confusion, or they no acknowledge them yet, or they no find help. So it's very important, if you want that training or you know person we need that training, make them follow the platform. We go drop information so that by the time the training starts, you say fit join. At the end of the day, if you get that knowledge, you feel you're looking for house, so that before you get money for all of the other extra where you feel for the picking, you feel start from somewhere. No go be like say you don't know what you want to do, or you just feel lost. So I want to ask our parents, Mr. Ezra. I want to ask you. So, say how I want to ask. Just give us maybe a short, maybe na answer, maybe na comments now about your journey with your Peking. How you take even notice say this Peking get issue, and how you take navigate say okay, this na the new normal for us. How we go fit arrange our family or arrange things for them so that this Peking go thrive, and we self also we know go dey too burnt out. You understand? As parents, where you be.
Okay, thank you. As parents, the way these things take start, it's a long story. Because if the thing start, it will be very, very ignorant.
Na so information no dey.
Not even information, even what they pick, the Peking they do, you know say it. I don't know whether I can use the word say don't come.
It's understandable.
So, like my own Peking, the way it started, the thing started, it started playing too much. And as parents now, when you see your Peking they play too much, you begin
notice.
You will begin question and you will receive beat.
Na so. Pikin no calm.
Things they play too much. You see them, they outside, you go push one. Go inside. Go inside, go give them.
You go say that discipline. Meanwhile, the pikin, he gets his own problem.
See something only happen,
Na so.
So like my Peking, the day where the thing come was, we come observe that is the thing come happen for school that time. The Peking was so, it just begin to, I don't know, it was so scaring. Like say something they scaring him, he was so afraid. Was shouting. And like we African, we believe in all this witchcraft.
Na so.
That time, for the school, the mother they work there. So as you see the thing they abnormal, like they can't go church, go pray for her. Go with it, believe God day.
Na so.
Someone the became
calm.
They calm. So yeah, it has been like that from one stage to the other until the begin to knock on the doing work for school. Before we let's say speaking something is really fun. And based on my own understanding, we just believe in a spiritual attack.
So
we just continue, we are just going for prayer until we reach some certain level, and thank God for everything. Come kind and go hospital and start to receive treatment. So at the point in time, they go school again.
Yes.
Because he was not doing anything in school. So we were even keeping it at home. Everybody would go with him for us, only him. So like that until we begin to look for information. Thank God for radio program. Like the way I came to know, say then they get special school for this kind of two radio programs.
You see, information.
Now him I even contact him for that program. From there, if now you come link me to my people, and she they assist me for the school to be present. So from there we come know say we get special school for these people.
Yes.
Thank God for the head now in school. Thank God for everything. The journey so far. I just did some action.
Of course, the journey long. The journey long because you must compress them. As person we get younger brother we dey on the spectrum. I feel sympathize and I feel see our own journey in summary as well. You dey go through all the stages of different things. Maybe say you don't try, you don't assume, and when information all day, you go first start with, no information, then you go enter denial, then you go enter okay, you go wetin you wan do, then you go find space for the pikin. All of this, the frustration sef dey, as Mr. Ezra dey talk, you dey see am say e dey relieve, almost recap the journey, and the journey is a very long one, no be 1 year 2 year journey. They don't come very far, but I like as he talk this is a very honest, realistic way this thing they manifest for many of our parents for this part of the world. Say we dey very heavy on religion for this our part of the world, and not be bad thing, but at the same time, sometimes we know they allow ourselves. God give us knowledge, God give people we go school ability. Sometimes we dey feel say those people they know go fit help us as much as our spiritual leaders, which as we dey see and many times they always work out for us. So now you can imagine if Mr. Ezra from the beginning they enter hospital, I'm sure say things go easy a bit more than
they pray, then they go hospital.
Exactly, they pray, they go hospital at the same time. I'm sure say it go easy a bit more, maybe not too much, because say every child they different. I'm sure say it go easy a bit more than that time where they in between the diagnosis and all of that. But all in all, as we're talking for this program, it's never really completely too late. So if you never get intervention now and you're there in position, go hospital. From there you go find your way around things. And when our clinical psychologists they talk about some of the problems where people for our community they go through, and he mentioned anxiety and low self-esteem. They could remember our community members where we meet from University of Jos. Those people, their self-esteem very high. I they tell you, very high. Both the cerebral palsy students, both the visually impaired students, their self-esteem are top notch. They see them confident looking at what they want, with all their limitations. They're very confident. They get dreams and aspirations. One of them even driving people drive them come. So it's very important as family and community make we help these children so that they feel get to that level. Also, maybe say they will go university, they go do things. And if university no enter, maybe they feel learn skill. Not everybody go school. So at least maybe also understand say some of them skill now go do instead of classroom. So I want to ask our psychologist. So we don't help us discuss some of the areas where we say una fit come in as clinical psychologists. Now I want to ask, where we go find una? Abeg, where we go find una? Say at the end of the day, the most important thing we say all of this answer and solution. It's very important to know where we go find them so that parents are not lost.
Now, one of the questions people they ask with that, and sometimes they surprise me. Where we say, I see somebody put online for Facebook say she never ever hear of any therapist for this Jos. It shocked me. For this year I see this thing for Facebook, and in a lot of times I go see people they ask, say where I go figure therapists for Jos. So the thing just they show say it get this big gap where they with between people we need our services and us. So it can't make me they think waiting we need do, waiting I need do as a professional to ensure say people get access to me. But funny enough, most of my clients say now Google then find me. Some of them go just say psychologist in Jos. They go say my name come out. So the best way where I go tell parents say if you don't know where you go find the best way, and I use Google. At the least, just search therapists in Jos. You go see people and where you go feel contact in case you don't know anybody.
Yes.
But officially, the first place where you go see clinical psychologists, one, now for teaching hospitals. Because for some of these for all teaching hospitals, psychology units there. And for that psychology unit, you go see clinical psychologists. For instance, if you go Jute, if you go psychiatric department for psychology units, some of us there. If you go Bingham, you go see some of us there. So, but some people no one go teaching hospital because They know what I mean and say, then they mad, or they are picking something they do. So they hide. Now, one of the problem be that. So another place where if you see us now for private practice, some of us, like me, I know they work for hospital. I get my own private practice, and people they reach out to me, and they provide services from my own organization. So one way you go take no again now to search. We no get unified database for Nigeria. Now one of the things where I don't they talk to my colleagues about. We no get unified database for Nigeria where you go search. For US, you get database. If you go search by state, you go see them. So you go just use Google search where be the centers, therapy centers where they before you begin call people, ask them. Very so important. 1 for hospitals, 2 for private practice, and I foresee for community centers. Unfortunately, we no get clinical psychologists where they work for community centers per se. Most of these centers, they consult with clinical psychologists. We'll call them. They will just come do work. They go.
Come out.
So permanently, we don't get them. We don't get them for primary health care for Nigeria. So the first place, if you don't know, go teaching hospital. Say you want to see clinical psychologists.
Okay.
Or you look for private organizations for your city where they into private practice, you will get professionals from there. So now some of the key places where you go find us be that.
Okay, thank you very much. Like I say, Mr. Anyone, you want talk something about this issue?
You know, say usually something they always did to talk to talk on top this program. You know, and now as Mr. Ezra just talk finish, now I sit down. You know, as professional, we they get this temptation. Say when they talk with person, your mind don't already they flag some kind terms.
Yeah.
Why go they do? You talk this thing. We know they talk this thing. Why you go talk like this? But then I consider again, follow reason the very human part.
That's true.
And I like the way you take join everything together. Say you appreciate the way. I know saying compress that story where you shorting now, I'm shorting now like man. It's like man.
Highly compressed.
But we fit like the tension, the emotion. You fit touch them.
Yes.
Like the thing, the tick like that. And I appreciate you, sir. Saying. You even agree come and you still the open mouth they talk about your picking condition.
It's not
and
easy for parents.
You know, say most times it's easy to talk about something when you don't come out.
Yes.
Maybe something been do you just then the thing don't finish. Maybe you
don't
heal. And you don't finish. Then you will come the tell people say, if you know what I passed through.
I tell you.
But this kind condition, this learning and developmental intellectual disabilities, life, most of them are lifelong conditions. So you never come out. You still there inside. So they take real strength.
Honestly.
Make you for feel open mouth. They talk to people about these things. And Mr. Ezra, we know for here we might be humans, right? We understand the human part.
Yes, so.
And so we not discredit anything when you talk.
At all.
In short, we accept you full. And this talk where you don't talk now, you don't know how many people you don't encourage.
Not true.
You don't know how many people you don't even encourage, make them come out their picking for us.
Yes.
Even that special school where they never they see plenty results yet. You get people who no even one year say they carry their picking go in the first
school.
place. So this thing now will be reason why 1, 2, 3, 5, 10, 20 families come off for us.
Yes,
and of course, waiting day front, they always better pass waiting day back.
Yes.
So not to keep the hope alive. Oh yeah.
Thank you very much, Mr. Ini. And also, as our clinical psychologist mentioned, when I ask him again where to find them, he mentioned private practice. He said, make una Google. Can if you Google if you enter hospital. So the options there. You know, say sometimes when some level of I don't want to say denial, more of fear. You know, say when you they think suspect something, but you they hope say no being be that. you go say they find solution, but you go find them with comma. You know go you know go find them with your full mind, so that So if if you use Google, if internet's no day, you feel enter government, if you enter kitchen hospital for just now Jute Day, bring him there, be you feel enter any of them. And like Mr. Ini talk just now, say to help these children, one of the first step now acceptance. You go as much as you can prepare your mind. Easy. It's not an easy thing to do. So you go prepare your mind down, so that just in case this is a situation, okay, how if you help this Peking become better? Then also, again, we don't talk and say we don't get unified database. So for parents, we've been saying they don't get data or access to private practice, or even what they call them using of internet. Your surest bet, once again, we don't talk about how many times for this program since morning now hospital. Your surest bet is still enter hospital, make them direct you, make them show you way. Then from there, you will move small. You will find your community. If it takes some time, but you will find them. And as they talk, Oga Boniface, you are very welcome.
This one can't sign attendance.
I tell you, because I dey look time. I look at Mr. Boniface enter.
I dey follow the discussion.
We thank you for that. Mr. Boniface, say you be speech therapist, and you work with these children on a regular basis. Now, I want to ask, say before these parents feel even begin to see therapists in general, wetin be questions will they feel ask the therapist before them start, in terms of things like progress, and also how them fit support. Say just like regular students, if your pikin go school give them homework, follow up. Your pikin go reach, you no go fit do anything, because no be one teacher go do everything. Na balance. So how, as a therapist, you fit, wetin parents go need know, and also for extra support once they don't reach house. And say some people no go get money for therapists every day, or even more than twice a week. So wetin be the aftercare and all of those things, say they go keep the progress consistent for these children?
For all my practice, I don't encourage parents. I don't encourage people we dey in the field.
Yes.
They prioritize communication.
Yes.
Over say make the child start to talk. You get some of our children where we say their conditions they so severe to the point where they say they no fit control the muscles where they need to make speech, clear speech.
Children like cerebral palsy.
Yes,
exactly.
Children will get cerebral palsy and the likes. In fact, you get some children will get multiple handicapping condition where we say they get intellectual disability, they get cerebral palsy. You understand? And they get other disabling condition where we never actually find out where they interplay, they cause problem in communication or in speech. So all those things now, one of the things where they ask. I teach parents and I teach even teachers, may they prioritize communication, find other means maybe say if you use to try engage that child, because the aim of speech now communication. Not true. Now the first thing maybe say I expect parents may they try to find out if they meet any therapist like any speech and language therapist we say. May they try make the therapist help them identify what the issue be. Maybe make sure say the issue of that child, the problem will lead to the speech condition of that child, they well understood. If parents don't understand them, they go just they play anyhow, they do anything what they want. Even they go go even know how to follow the therapist for what they do. They go know how to do follow up for house. So they need to understand that condition, what it be, how it they disturb this child, how it don't affect the child development according to the ages and the stages of the milestone where they need to meet. Now waiting they need to understand first, because now from there we go understand how we go help that child continue to move up the milestone of in speech and language development. Yes, very key. And if parents understand, say okay, my child dey age 5, he's supposed to reach this milestone for in speech and language development, but he never reach. and see where in dey. You know already they don't get idea of okay, see where my child dey, see where we need to meet. You understand? Already goal don dey established. They go in fact some parents wey don go advance. Wetin I mean by advance, wey be say they know how to use the internet. They go internet, they browse some things, they get ideas. But if they know the condition where the child dey according to ages and stages of speech and language development, it go dey problematic.
So.
Because if I tell you say maybe constantly understand the condition, the diagnosis, for instance, you say this child get apraxia of speech or this and that. You know that those terminologies now
they confuse our parents.
But the easiest way where they functional, where be say parents fit understand and fit follow up with, now to understand their level of speech and language development, the level where the child they fixated at, or they make I not use big English, I beg make una no
It okay.
The level where the child they, as for that time we do assessment. And the level where it's supposed to be based on the chronological age, based on the actual age. You get my point?
Yes.
If you know one, then that one will really help parents a lot to come into the
Okay, thank you very much, Mr. Boniface. I want to ask Mr. Philip this same question, but as a clinical psychologist, you know, waiting be those things we say parents suppose they ask, you know, when they come to you, and which be say they're supposed to look out for.
Yeah.
They say, okay, this speaking, they need this psychologist help so that they will know where to come when problem there.
Yeah, so like just to build on waiting him don already talk, it is important make parents ask the right questions if they come meet professional. And one of the key things where as a parent you want to know who be the professional way you they talk to. Waiting being area of expertise. You want they confident enough now part of your right as a parent to know who they take care of your pikin. Because like in talk, it is important to find waiting be the problem where they worry this pikin. They call them diagnosis. If as a parent you don't already get diagnosis, fine. But if you never get diagnosis, if you come to me, for instance, as a psychologist, you want to ask me, waiting be my area of expertise, which cases I they deal with, so that make you know whether I be the right person we go take care of your pikin. Make you know just say, clinical psychologists, we be clinical psychologists, but we get different area of specialization. As a B, I get play therapy certification, because I also they work with children and young people. So ask the professional, waiting be your area of expertise, which cases you they deal with, so that as a parent you will know whether your child will benefit from this professional help.
Yes.
Secondly, ask them their years of experience, for how long you don't they do this work, so that make you know say no be JJC you they
Fresh graduate.
you they get make them not use you do experiment to make sure say who they deal with gets experience.
Yes.
Good experience. At least I go say at least 5 years experience. If you know reach 5 years, make it be say the person the reliable facility where you know say supervision day. For instance, if the person they youth, or if in the private practice, then get group of professionals where they work together. You know, say no be one man person where they do no get accountability. So now another thing where you want know be that. So you want know their area of specialty, you want know their years of experience, how long they do this thing. And it go fun you, but you want they sure say this person go school, he go this school.
Yes.
Where he saying go. That one where they call on certification, you get certificate to do it they do. You get license.
License.
You understand? No be say I know people for this jobs where they call themselves therapists. We know them. So I know one open chapter. But wait I want make sure say who you they deal with now professional.
Yeah.
He go school, he get certification, he get licensure or license.
Exactly.
It is important so that you know say the person they provide, because for this our job, you get what they call principle of do no harm. You guys, if no be trained professional, it will make the child case they worse. You know, go help you, the parents and the child, the way it's supposed to help you.
Exactly.
That's why you need professional. We know ethics. We know the discipline. Where they practice. We know in limits. We know say my work start from here, he end for here. If you pass here, I go refer you go Mr. Boniface place or Mr. Ini place. Make them do their own. So now why you supposed to ask those questions?
Okay. Mr. Philip don't answer his next question during this question. Okay. So I want to pose the question to Mr. Boniface and Mr. Ini as therapists and people where they deal with these children on a regular basis. This question, our last question for Natu, then I get question for Mr. Ezra. Mr. Ini, so as Mr. Philip don't talk, I want to make you also analyze on some of the red flags, maybe say parents feel look out for. You know, say this our community, unfortunately, get people will say they see the fear, the vulnerability of these parents, maybe say, and also the desperation where they get. Maybe say if they find help for their children and they're very desperate, they want make children get better. So people they use that desperation till they make money. You know, say they go overcharge, or they go say there be specialists they never even go school for the issue, or they don't even get any training whatsoever. So what thing be those things that we say parents feel look out for so that they don't go fall inside this trap?
They don't come around me, so na me go first talk with that. I know say time don't run away, so now two when I go talk now. First thing, if person tell you say if you do everything, say if you do speech therapy, if you do behavior therapy, occupational therapy, say now waiting they do self, now waiting they use chop, say educational, say if physiotherapy man they do run no. I tell you, yes, just run. Now problem with different because most times people with their eye they tear like that. In short, any true professional inside your training self, then go tell you where your work starts, where you end. Just like with Mr. Philip talk.
True.
So if person tell you says I be do everything, and you know they work with other professional, you know they even refer you go another person. Now where therapy starts and stop with that person, run. Now the first thing when I want to talk with that, then. The next thing I say, if you meet person, especially for this our community of people when you get learning, intellectual and developmental conditions, if anybody tell you say, in get waiting, he go give you, we go cure your picking condition. I know this run self, no be leg you suppose use. I'm telling you, person tell you say, he get waiting, or he get where he go carry you go, or you get waiting, he go just arrange give you, we go just cure the thing. Make a don't end for the but shall run.
Very important.
Find another place.
It's important that you buy sneakers so that the run go easy.
Yeah.
Okay.
Mr. Boniface.
On top
yes.
Waiting or guy you don't talk. You know, like waiting we don't establish already for every professional practice. You get where you start, you get where you stop. You get where you need to call in another professional. Even if you maybe say you get training for that area. Get qualification for another area, you go day good. Maybe say you focus on one area, master that one, hold that. Know your boundaries. That one, now one thing we suppose understand.
Not sure.
Another thing be say if person start to tell you say you see your pikin, but he don't give you within 2 years we go cure everything, or give you time range. Tell you say within this time, this period. Everything
your pikin will begin talk.
Your pikin will begin talk. No say that person no get experience.
That's true.
The person no get experience, because for my experience now all those things they gather small because now management strategies they teach the person. They help the person make him learn to actually live with that condition. No be say they help and make he overcome the condition to the point where we say day again. Since we don't establish say this thing now more like lifelong condition. No, anybody will tell you say like Oga Ini tell you say you get cure for this particular thing. or he tell you say within this time range if you just engage me my services this you no go see this thing again, you no see that person. That person dey lie. That person no get experience. So now wetin I just wan add because no time now.
Yes, thank you very much. Mr. Ezra, I won't come to you again. I get now 2 questions, but you will help us answer them because I really want to hear from you again. As a parent, you know, this is your day to day for you. Don't say therapists, we they see them after a few hours, you don't go. But when you live with them from 24/7, 7 days a week, is a very different experience. Waiting be the some of the red flags when you as parents fear advise other parents. Maybe say you don't see for some area. For example, now maybe some clinics when you don't observe, or even some therapy or that way you say you don't just say this thing based on your own current knowledge now. You know, align with waiting this speaking supposed to the learning. You say you feel advise other parents so that they don't go make the same mistake, and also how you feel help us encourage, you know, advise parents on a general say, you know, give them support now, moral support. Not say once parents feel bond with other parents we get the same problem, they make the issue lighter. They make them easy. You say person will understand your situation on a personal level. It is different. So how you feel advise our parents, and so that they go feel understand say this thing a journey, and you know, make them not fit in a very, very terrible long life sentence. You know, give them hope ahead.
Okay. So for let me say, if you get picking where they this kind of condition, the one of the greatest word here now is just patient. Because if you go clinic self, you just have to, because sometimes you go to clinic, the doctor will just see you, okay, how you be. Now those questions will not ask you, those right drugs, then you go continue.
That's so.
You know, go expect you maybe you go expect maybe they will do something, but that higher they will just still write the same medication, so we go.
Yes.
You understand? So you just them they are following the picking gradually to see how he respond to the medication that he's taking. So my advice to parents, they should be patient and do and follow up their clinic days. And just for the therapists, like you have heard from their mouth, they say you must know, make sure the person is professional.
So
And ask questions where necessary. You need to know whether now that person fits.
help your picking.
Understand? So they need to get the right people, talk to them, and follow them gradually.
That's so.
And for the parents too, honestly, parents we did this. You know, when you talk of a parent, you need to play their own part. But one thing I discovered that someone like me, honestly, there is no time. Time is one of the factors that is affecting parents from taking care of these children.
That's so.
Because they have their own work they are doing.
That's true.
Before you could go and come back, you are tired, you want to rest. Which time do you have to
Very realistic. Very realistic.
to begin to see, okay, what thing this boy go to for school? It's not easy because because you need time to. It's not for somebody that you just you can just teach them sharp like this.
Exactly. Extra time.
Now on Monday when I saw the right assignment from our kid, the mother said, "Oh yeah, now I'm helping see waiting." When I begin start, already I'm tired. And if you are not, you know how they are. If you are not patient, you can easily get annoyed.
Of course.
And
Yes.
if care is not taken, you can start beating that kid. So what parents really need is time. And you know, in this our country where to find good job is a problem. especially when you are a parent, you are working with private. You know how private will drain you. You make sure all the most important time of your day, you will consume it.
Very true.
You understand? So
these are the issues.
I don't know when I'm answering your question.
Yes, I understand. And
I want to also say, parents where they need help.
True.
They need help. If they can, if there is a way they can get support so that they will have time for these children, it's very, very important.
Yes, very important.
If they do not support what the teacher is doing there, they will not get the result in time.
Yes, and more frustration for them again.
Yes,
no progress.
So that is the only.
Thank you very much, Mr. Ezra. I think Mr. Indy wanted to add something.
Well, I just one very short comment. Since our better people don't sit down with us reach this kind of time.
Yes.
The way why I want make approach this thing, I say the same way where you go make time for your picking way they typical.
Yes. You go find time.
Now the same way where you go find time for this one. Now
Mm.
your own and not only you. Now only you as the parents go fit see your child like your own picking. Another person no go fit do reach you. No matter how they try.
No matter.
So it still come back to you.
Yes.
It still come back to you. If you reason like that, I believe say we go there.
Inshallah. You know, and now why I say I appreciate and I like as parents today podcast. You know, it's good maybe they hear the very raw lived experience and raw inconveniences and issues where they arise from this problem, because you know, say every parent situation they different, every family situation they different, and every child in our community they're very different. You will see children that get cerebral palsy, but they are very different. Same thing with Down syndrome, they are very different, and autism and the likes. So having parents, maybe they discuss, and again, now why this podcast and this NGO, they also as a form of support. Now why would they bring knowledgeable guests come to give this information, maybe say parents know they get access to, and also because we are based in Nigeria, and they give solutions that are very much tailored to Nigeria. And say Nigeria, it gets your own comma. It gets us to be, get your own all of the question mark where they follow our system. And having this podcast, hopefully more parents go tune in so that they go hear from fellow parents, and they go also get guidance on where to get help and how to go about help. It's very important. And again, I want to recap again. You could not go hospital. I know say we don't talk plenty time, but I need to be saying it regularly because, you know, again, we are very spiritually and religious inclined in this country. In their importance, make we enter hospital. Your picking get special need does not make them completely without any form of ability. Understand? They fit do something with their life, but you have to accept, say, okay, this is the problem. We go start from here, make we find solution. Go government hospital, because you know private expenses, all of these things. So enter government hospital. The process feel long, small, but you will get your results. You will get access to resources, and then also like all of them mentioned, including our parents, Mr. Ezra, say make una dey ask questions. No believe anybody just because they call themselves therapists. Be like some way you look for social media now, say everybody they say that they be forex trader. Everybody know forex. They carry camera system online, say I be forex trader. It's camera off and they pay for course. I beg, ask questions, ask proper questions so that you no go waste time with those people because they're not going to help your picking at all. And also, I want to use this opportunity to congratulate our giveaway winners them from last week where we do our giveaway. Congratulations once again. And I appreciate those who say they win money more than one time. Yes, so they win money more than one time. And our ChatGPT warriors, we see we see una too. Well done, and thank you very much for tuning in today. We don't we don't pass our time small, but I believe say our information they very important, and also this our situation make we try remove shame, to a large extent, so that we go feel help our children, also help ourselves. If we don't help them, they go turn to us, lash that their frustration, the anxiety. Now us go still carry them all of the pain, because now they're familiar with family, so they will direct the anger to who they know. So now do well for staying this time, and our hosts and our guests, also our fellow hosts and guests, thank you very much.
Thank you.
Thank you very much. So
Thank
now
you.
do well. Thank you, and we will see you on our next Saturday. Bye bye.